Hey girl, hey, this is Dr. Tasha, and I am back. It's supposed to be a Thursday moment, but honey, I forgot yesterday was Thursday. I'm trying to get everything together and, read all these messages and DMs about the retreat, which I'm so excited about, y'all. I'm gonna break y'all down right quick on what we got so far. But I forgot yesterday was Thursday, so it's a Friday moment, and I was at the warehouse doing clean and cute stuff, making product. So it ain't even 7 o'clock, but y'all get the idea. So, want to break y'all down real quick on the retreat. I'm so excited. Friday is a straight up welcome to Atlanta block party. When y'all get into the hotel, y'all are going to check into your rooms. You'll have your swag bag. It'll be a cute little something, nice little bottle of water, whatever, waiting for y'all. And then you'll come downstairs and honey, the chef is ready for y'all. The bartender ready for y'all. And it's going to be a Kappa Punch kind of evening. That's obviously complimentary. The food, the Kappa Punch, complimentary. If you want a little something else, honey, you're going to have to tip the bartender. You're going to have to tip the bartender. We might charge you a little $2, $3, something childish for your little shot if you want it. But that's what we're doing. So you'll eat, you'll interact with people, take pictures. We're going to have gorgeous areas for you to take pictures for the gram. And then we're going to do a panel. So we'll have the young men of Kappa Alpha Psi and probably a couple of OG Kappas and then a couple of other people. We're going to have our boy, Dr. Montgomery, who y'all know got plenty of swag. He'll be on that panel as well. And then it'll be up against some fierce females who I'm not even going to name yet. Our MC, who I am itching to name her. But until the contract is signed, I will show respect and not name her. But when y'all see who is MCing this thing, baby, it is laughs on laughs on laughs. So we going at it. We got these questions for the males versus the females. Y'all are going to be able to kind of jump in, chime in. Our MC is going to be walking around with a microphone. We getting it in. We going down. Okay, and then the Kappas are, they're going to do a little, they little shimmy situation, a little cane situation. They're going to give us a little show. And then we're going to do our boots on the ground. We are supplying the fans, by the way. So we're going to do our little boots on the ground. We're going to pick 5 winners. Those winners are obviously going to get prizes. And then we're going to record with our director, a cute little commercial type skit type thing for promo for next year. But also, you guys, I don't know, we might be in deals with somebody because you guys might end up on a TV commercial. I don't get paid, so y'all don't get paid either. So, but y'all will be on TV. So there's that. Saturday, it's going down. Is it Saturday? Yeah, Saturday, y'all come down, have breakfast. The breakfast, we don't play. We ain't doing no bagels and all that. We're eating. Okay, real big back behavior, which we about to talk about shortly. So we're eating, and then we're going to get started with our sessions. It is going to be stuff you want to hear, the breakdown. You'll have access to the physicians who are talking, very laid back, relaxed environment, snacks available to you all day, beverages available to you all day, breakout sessions, free HIV testing on site. Okay. It will be games, gifts, prizes, all the things. We try to leave you better than what we found you, okay? And then we'll do lunch, which obviously is provided as well. We do some more sessions. We got some after lunch gets a little risque. It gets a little risque. We'll be talking about life with Perry. We have a whole sex session, honey, and it gets risque. It goes down after lunch. And then even further down in the day, we have very, very, very heavy hors d'oeuvres for you guys. And again, all of that is included. And then we conclude for the day. If you guys want to go out and see the city, see Atlanta, do whatever, go to your room, hang out around the hotel, at the hotel bar, whatever. It's a gorgeous, gorgeous hotel. And you guys are really going to enjoy it. And then Sunday, again, breakfast. And we don't play about our Sunday breakfast. All the chef, so y'all know the food is going to be bussin', okay? And then we're going to wrap up. We're going to take some pictures. We're going to love up on each other. And I'll probably do like an Instagram post with all of y'all in the post with me. And just, thank y'all for supporting each other and supporting the cause and supporting the health and well-being of Black women. It is going to be a time. It is going to be like a sophisticated, bougetto, empowered, educated sleepover. So we're going to have a great time, and I really, really want this for all of you guys. I done put the QR code, I done put links up, I done gave y'all emails, we done gave y'all the cell phone number to the person who, look, I can't do nothing else now. I can't go to your bank and swipe your card I can't do all that. We gave you Klarna, we gave you Afterpay. That's layaway. For anybody who don't know what that is, that's layaway. Okay. But at the end of the day, you guys don't even know how much I want to see you in the building. This is going to be such an amazing thing, and you're going to learn so much, and you're going to grow so much and gain so much. So please, please, please join us for that. Anyways, okay, so now let's get to the meat and potatoes of it. I'm very blessed that people come from far and wide because they appreciate my honesty, and they appreciate the fact that I know what I'm doing, and that I call a spade a spade. And I love y'all for loving that about me, right? And you know, I see a lot of patients, and I'm like, okay, so what medical conditions do you have? What medical conditions do you have? Now, I can tell, and this is not an insult. This is not a shot at anybody. This is what I do. You guys know, outside of being an OBGYN, I have additional training in obesity medicine, right? So based on somebody's BMI, you know, I can kind of tell if you are pre-diabetic. But I'm always asking, so do you have pre-diabetes? And some of them will say yes. And some of them be like, no, I'm good. Now, understand, you come in, you're a little thick and fluffy, or you're over 50, I'm checking. I'm going to check something called a hemoglobin A1C. And I'm going to talk to you about that a little bit in a second. But what I hear is, yes, I'm pre-diabetic. Well, what's your treatment plan? They told me to watch what I eat. Well, hell, if you was watching what you was eating, you wouldn't be pre-diabetic. So basically, they're sending you back out in these streets to do the same thing you're doing. What are we waiting for until you actually get full-blown diabetes? That's not a plan, right? And I don't like it. I don't like it. And you're going to hear some of my sensitivities in this video because I take us real serious, right? So let's get back to those who say, oh no, you know, I'm not pre-diabetic at all. So hemoglobin A1C is a blood test, and it's really interesting because what it shows what your blood sugar on average has been for the last 3 months. So sometimes I draw people's hemoglobin. Oh no, girl, I had just had a bagel before. I don't care. It shows what your blood sugar on average has been over the last 3 months. So when I get, and most recently I had somebody that's like, oh no, I'm normal. And I'm going to break down the numbers for y'all. But she was so close to diabetes, there's no way that 3 months ago you were normal. There's no way. So she's like, my doctor said I was normal. Did they check? Because if they checked and that said normal, I know you's a Donald Trump lie. So when you have hemoglobin A1C, anything less than 5.6 is normal. I include 5.6 too, but 5.6 into about 6.4 is pre-diabetes. Once you're above 6.4, meaning you're at 6.5 or higher, baby, you're diabetic. You a diabetic sugar. And people say, oh no, I was 6.8, but we got it back down, so I'm not diabetic. It don't work that way. Once you are a diabetic, you will always be a diabetic. You are a diabetic. If you go above 6.5, you are simply you are diabetical. You are diabetical. Okay. Now, you can always get the number back down. I get it back down for my patients very easily, very quickly. We don't play at Atlanta Premier, but I let them know if somebody asks about your medical history, you say, I am a diabetic controlled with diet and exercise. My hemoglobin A1C is this. Now they see you're diabetic, but your hemoglobin A1C is 5.3, 5.5. That's not even in the pre-diabetic range. It's like, oh, okay, that makes sense. But don't think because your numbers got back down to normal, you're no longer pre-diabetic. Now let's explain this whole pre-diabetic thing. Now, I'm going to, and in my program, I call it metabolism management, right? Because what burns me more than anything is women who are of a certain age and are chasing a certain weight. Don't do that. It's not about your weight, and it is about your weight, and we'll get to why more importantly, but it's about your health. Like it really, and I have patients like this, and I really have to keep my cool with them, because at the end of the day, you have to have patience and you have to meet people where they are, and they might not get it right now. But if you keep working with them, they might get it in a month. They might get it in 2 months. So you can't be like, so I keep my patience, but y'all know I keeps it 100. And so at the end of the day, it's not about a number on a scale. Like it is about your health and your overall well-being. So when I say that, when we talk about pre-diabetes, I told you the hemoglobin A1C is what kind of determines that. But when you have a BMI that is greater than 36, baby, you insulin resistant. You insulin resistant, aka pre-diabetic, is all up in the same. The treatment is the same, is all up in the same wheel well. So if your BMI is greater than 36, or your abdominal circumference, meaning if you put a measuring tape around your belly and that's greater than 36 as a woman, well, greater than 36 as a woman, greater than 40 as a man, come on in here, girl. Come on in here, girl. Take a seat, because you one of us. You one of us. Period. Now, let me be very clear. I don't agree with what I see with a lot of primary care doctors who are like, oh, you're pre-diabetic. I'm like, well, what are you on? They're like, nothing. They told me to just change my diet. I don't like it. I don't like it, especially when you have a precondition that can turn into a chronic condition that can turn into somebody's death or downfall. Why are we not being aggressive? What y'all doing? Like, I get, and this goes so wide. So it's like, it's hard for me to kind of like keep my thoughts like that, because it goes so wide and far and deep. When we are dealing with prediabetes, there is a medication that I start my patients on, and a lot of providers do start their patients on it. They just don't really know what they're doing. And again, like I said, I have additional training, so I'm blessed in that way, but you just can't put that patient on that medication. And I'm gonna tell y'all what it is, and I'm gonna tell y'all the benefits of it and all the things, because it's important that you know. And you can't just throw somebody on this medication and then just leave them there. No, you have to tell them what to do, tell them what not to do, tell them what to eat, tell them how to exercise, all the things. It's like, it's not what you would think. So my women who are perimenopausal, once you kind of get to that age group, baby, if you're not pre-diabetic, you're definitely insulin resistant 9 times out of 10. And we're going to kind of treat you the same way. We're going to kind of lump you up in that thing the same way. But when it comes to prediabetes, again, at the end of the day, what are we just waiting to become diabetic? Them folk didn't lie. It is what it is. Pre-diabetes, meaning before diabetes. So my thing is that it's not easy. If you have somebody who, and this is why I always say, I hate to say this, but if you don't understand Black culture, and I'm not talking a color, I'm not talking a race. If you don't understand Black culture, you will never successfully treat a Black patient. I said what I said. I said what I said. You mad? Drop a comment. I'm okay, because it might be a day where I have time and I will check you real hard. But I said what I said. And why is that? Because y'all are saying, these people, oh, you're pre-diabetic. Like, that's supposed to turn a light switch on. For 1 out of 200 people, it might. But the reality is, you're sending people home to do what they've been doing, what they culturally do, how they culturally eat, how they feed their families, you're sending them home to do the same thing and saying, oh, you know you're on your way to diabetes. Okay, carry on. No, that's not how you do that. So one of the biggest things for me, like I said, when it comes to weight, let me tell you why weight should be a thing for you guys. Because people say, well, it don't mean because you big, you unhealthy, and it don't mean because you skinny, you are healthy. You're correct. You're correct. And I say all the time, I don't deliver babies no more, but I say all the time, I'd rather deliver a 40-year-old woman who is responsive about her weight, responsive about her health, and is eating vegetables and drinking water than to deliver a 22-year-old who eat Chick-fil-A every day. So you're right. It is not necessarily about the weight, but I wanna give you guys something. For every 1 pound you carry, your knees carries 4 pounds. 4. So if you're 250 pounds, which is not like, and I hate to say it, in our community, it ain't like Big Bubba. Like, people don't start checking you about your weight. Like, girl, you need to lose that weight until you like over 350 in the black community. I hate to say it, but it's true. So 250, you just thick. But if you're 250 pounds, each one of your knees is carrying 1,000 pounds, which means your hips is carrying 2,000 pounds. How much does a car weigh, sis? 2,000 pounds. So it's no surprise that our hip replacements and knee replacements rates are going up. It's no surprise that like half of the black women you see are waddling. Once they reach 50 and 55, they just wilding side to side. I'm not making fun of anybody. Please don't think I am. But I'm keeping it 100 with you because that's what we see. And then they say I'm bone on bone. I ain't getting that surgery. Well, yeah, that's why, because for years and years and years. So it's not as though you're unhealthy because you're overweight, but that stress you're putting not only on your heart, but you're putting that stress on your joints. So yeah, weight matters. It matters. Now, when we talk about prediabetes, you can kind of think of it as the anti-carb situation. If you are pre-diabetic, please, I need you to take 2 steps back and 1 step to the left away from them carbs. And let me tell you what the carbs are, because I can tell you what we do in my program. No sugar, no rice, no bread, no pasta, no potatoes, no grits, no oatmeal. What else? No quinoa, because if you look at the nutritional label, that ain't much healthier than rice. And then yogurt. I don't really have a thing about yogurt. Like, I'm not coming at yogurt hard. I'm just saying that most of the yogurt that y'all are going to enjoy is just full of sugar. So what we really doing? The only yogurt that's really kind of good for you is the nasty kind. That ain't got no flavor to it. It's vanilla. It's Greek. It's thick. It's weird. I don't like it. If that's what you into, rock out. But cottage cheese is always going to be better. It has a lot of calcium with it and a lot of protein as well. So for my program for patients, it is high protein, low carb. I did not say high fat. I did not say keto. I said high protein, low carb. And you have to do that within a certain, wheel well. So we say meats and vegetables. And if you're not a meat eater, fine. If you're a pescatarian, if you're not that's fine. But we also limit beans, because while beans are pretty nutritious for you, they are very high carb content. So until we actually are able to switch your metabolism back to a healthy metabolism and get you on the right path, don't do that. So we're going to keep you away from those foods. So we say meats and vegetables. When it comes to sweeteners, you can do monk fruit, Splenda or stevia. No honey, no agave. Oh, did I say nuts too? Yeah. Now, nuts aren't bad, but we keep you in a program below a certain net carbs, and net carbs and carbs are different. And it's not that nuts are bad for you. So if you get like a salad with nuts on it, rock out, girl. If you grab a couple of, nuts, rock out. But a lot of people tend to think, well, I'm gonna eat a bunch of nuts and drink water, and that's gonna be healthy for me. It's not. So, how you eat, what time you eat, not really a time, but how you eat. I prefer for people to graze throughout the day than be stuck to breakfast, lunch, and dinner. Who gave us that? Who made it that? Because when you wait too long to eat, your sugar drops. And when your sugar drops, it's like, oh Lord, I got to eat. You get some sugar. You eat, sugar goes way up, and the insulin spikes. And when insulin spikes, you gain weight. So eating throughout the day consistently actually makes you lose less weight. Then people want to get on me about intermittent fasting. Listen, you want an intermittent fast, boo, for structure or for whatever, do your thing. But when it comes to intermittent fasting, do you realize that the only studies have shown, and I'm just going with the studies, I don't want to squabble. If you like the intermittent fast, do you, boo? We ain't got to argue about it. If you want to be hungry until noon, be blessed. Okay? All right, now. But studies have shown that the only actual intermittent fasting that works is 5 and 2. And that's when you eat regular for 5 days and then you fast with water and like tea for 2 straight days. I don't know about y'all, but I be trying to fast for spiritual reasons. Baby, by 11 o'clock, I be hungry. I done forgot I fasted. I done threw a Slim Jim in my, baby. Listen, I don't judge. If you can do it, do it. But 5 and 2 has been shown to help with weight loss. Really, most people do 16 and 8 when it comes to intermittent fasting. And that really is more for structure, but not for weight loss. But anyway, lest we digress. So eating is very important, and exercising. Did y'all know if you insulin resistant that you can't lift weights? Yes, baby, it will trigger that testosterone. You think you a big back now. You think you a big back now. Okay, all right. I'm just saying. Now, and don't be offended by that, because big back is it's a mindset too. Some of y'all really physically are big backs, but it's a mindset too. And again, I'm not skinny, so who's judging? We don't judge over here, but we do hold accountable. Okay. Now, why do I say that? Because when you do weightlifting, it triggers your testosterone. So how many of y'all, and let me go with me this, how many of y'all had a trainer before, right? And shout out to all the trainers, but I don't really like y'all that much. But y'all have a trainer. So the trainer, all they really do is want you to lift weights. But what they don't understand is when you're helping somebody lose weight, you're not training their body. You have to train their metabolism, their anatomy, and their physiology. You're not training their body. Half of them are only going to do for you what they did for them, and they don't really understand the mechanics of what they're doing. So you get a trainer, and for like a month or so, you might have lost like 2 or 3 pounds, maybe even 4 or 5 pounds or whatever. You like, okay, but it gets to a point where you stop losing weight. You're doing the same things. You're doing the program that they're telling you. You're doing what they tell you to do, eating oatmeal for breakfast, which is the wrong thing to do, and then having that nasty ass chicken breast and broccoli with the Mrs. Dash on it and all of that, right? And then you feel like, well, I'm just gaining weight. And then they start arguing with you. Well, you must be cheating on a diet. And no, that's not it. It's just that you can't weight lift because you're insulin resistant and you're triggering your testosterone and you're getting more husky as the day goes on. So, yeah, let's not do that. But again, you have to have somebody who understands that and is able to come up with a fitness program for you, is able to come up with a diet, maybe even specifically for you, and then medication. Now, I'm not going to go into detail with the medication. Some of y'all will probably even be able to guess what the medication is, but I'm not going to go into detail. Now, y'all know how I feel about my vitamin D. I don't play about it. Once a week, consistently throughout the year. I don't play about it. But there is a particular medication that I do start my patients on, and I can take you anywhere from 1 pill to 4 pills a day. And I follow my weight management or metabolism management patients every 5 weeks, and I make those adjustments based on, are you craving? Do you have a lot of food noise? What's your energy level like? What's your appetite like? How much weight are we losing? I make those determinations and I make those adjustments based on what I think, what I feel. Will I add on other medications? And we'll talk about the injectables, but will I add on that? But that's not my primary medication. The medication has been bastardized in our community, but what they haven't told you is that it decreases your risk of coronary heart disease, heart failure, and heart attack. It also decreases your risk of fatty liver. It treats fatty liver, actually. It helps with your weight loss. It prevents a pre-diabetic from going to diabetic, and it actually even gets you out of the pre-diabetic phase. It helps with infertility. It prevents long COVID. It helps with your immunity and your overall lifespan. It also helps prevent Alzheimer's, and get this, it also prevents 10 different types of cancers. Right, but they bastardize it in our community, and let me tell you how. Because I'm not taking that. Pop. So what they did is they gave the medication, because a lot of times a lot of diabetics are on this medication. They gave the medication and said, here, take it. But what they didn't tell you is that if you're on the medication, you cannot eat carbs. If you eat carbs on that medication, baby, let me tell you what. You're going to lose. You're going to lose. The medication stands on business. You're going to be nauseous, or you're going to be on the toilet. You're going to lose. But they didn't tell you that you can't eat carbs with it. So then it turns out, this medication is horrible for you. It's not. It's amazing. I think it's the thing that's going to save the lives of Black women. Go with me on it. Also, I'm very particular how I have a regimen and how and when to take. You only take it once a day in my practice, and we're on extended release, and there's a certain kind of way that my patients take it. Nobody has any problems, nobody has any issues, and the weight loss is rapid. The patients in my program who are on metabolism management are probably losing anywhere between 9 and 13 pounds a month in a healthy way, because we're eating, we're hydrating, we know what we're doing, we're strengthening our heart, we're moving, we're doing all the things, we're getting our joints healthy, we're decreasing our inflammation, we're fixing anxiety, like it, girls. But this whole pre-diabetic thing, I don't like it. And a lot of times I get pissed off specifically because in our community, a lot of times we like to try to see doctors that look like us, and we tend to feel that because they look like us, they have our best interests at heart, and they're doing everything that they can do and everything that they're supposed to do for our well-being. And it pisses me off with the doctors when that's not the case, because these people are trusting you and they're doing what you're telling them to do, and you're not doing the best thing. You're not doing all that you can do for them. So I mean, it's just like, that's crazy to say, to have somebody come in, somebody on crack. Shout out to, no disrespect to anybody who's on crack. I don't want no smoke, but that, no pun intended. So you have a crack addict come in. Oh, you're on crack. Okay, stop smoking crack. We're gonna see you next week to see if you're still on crack. What? I mean, but girl, so when you got that big midsection there, I got it. But when you got that big midsection, it's carbs. It's because I'm a donut eater, honey. I love a good donut. Love a good donut with a ginger ale. That's my problem. If I did half the stuff that I tell my patients to do and that my patients be doing, honey, they start out bigger than me, end up smaller than me. I'm still where I'm at, child. I need help, prayer, and y'all keep me lifted. No, some of y'all don't pray for me. Y'all might not be okay with Jesus. I don't know. Don't worry about it. I got it. Don't worry about it. Don't worry about it. But anyway, so the point is, please make sure, when you're saying to your doctors, as we get older, especially being African American, as we get older, as our weight starts to increase, you need to say these, am I pre-diabetic? Can you check me? Well, what can we do? Is it a medication? I mean, what should I be ask these questions. But a lot of times I think we don't want a diagnosis. We don't want a label. So we don't ask questions. Sis, that ain't hurting nobody but you. Because whether you ask the question or not, whether you have the information or not, you are the one who becomes diabetic. And then they start, and let me tell you, when you become a diabetic child, everything you go to the hospital for, I got this headache, you probably your sugar. I don't know, something wrong with me, you're diabetic. You need to lose the weight. They stop listening to you, and everything gets blamed on your diabetes, right? And I don't want that for any of you. I don't want that for any of us. So at the end of the day, make these people stand on business. And if you have somebody who's not doing what they're supposed to do, please do not be afraid to change providers. I keep telling y'all this. Like, do not be afraid. Like, people do what they know that they can do. Now, in defense of a lot of providers who happen to work for corporate entities, hospital settings, do you know that they time them with patients? That's why I couldn't do it. I gotta be over here stressed out with thinning edges because I can't work in these environments. But I think like for an annual exam, you might get like 17 minutes. Honey, by the time I get in the room, be like, what's going on? What's the latest? Who the new man? Well, did you see his testing yet? Well, do he work? Child, 20 minutes done passed by the time I do all that in the room. So I can't imagine seeing you, figuring out what's going wrong, examining you, prescribing medications, diagnosing, and out the room and on to the next room in 17 minutes. Child, that's why they missing everything. But at the end of the day, if they're not going to be cognizant of it, you be cognizant of it. If you're a pre-diabetic, you think you're a pre-diabetic, hit us up at Atlanta Premier. And we can get you into our metabolism management program, and I can fix it. And part of what I do is not only just fixing you, I help you understand what's happening in your body so that you can fix yourself. And so that once we get you where you need to be, you don't need me anymore. I mean, you might need me for a prescription or two every 6 months or whatever, but you don't really need me because you understand how to manage your metabolism, how to manage your food, how to manage your own weight. I teach it to you. Like, I don't have a desire to have you attached to me at the hip for life, but I do have a desire to have you healthy and understand what's happening with your body. And what we need to start doing is pollinating positive things in our community and pollinating positive information to each other, because nobody's coming to save us. If you didn't figure that out yet or understand that, nobody's coming to save us. So we have to do it for each other. And unfortunately, you do have some providers that are our skin tone and color, but are just not good. And if you happen to run into one of those, dip. Don't be scared. Dip. Do not be afraid to dip. Okay. Now, I do want let's talk about this little big back thing a little bit because I think it's hilarious personally. And big back is, yes, it's a behavior. Yes, it's a behavior. And I'm gonna say when we went out to that, we had the best intentions when we went out to that the food festival in South Carolina. Nobody said it was gonna be 102 degrees and there was gonna be no shelter from the sun. After about 20 minutes and waiting in line for something, that's when I realized that was big back behavior, because that was stroke heat. That was stroke, and damn, they had one. That was stroke heat. Get up under that tent, get you some cold water. Ain't nothing work. Babe, we can check into a restaurant and get a little bit of everything they had out there, because who is doing that? Big back behavior. Now, some people are physical big backs, but it is what it is, and it's subjective. So, you have people who are normally 120 pounds. They've gained weight. They're now 170, 180, right? To them, they are big backs. They're huge, and they will constantly say big back, big back. But you share a work stall with somebody who 240 easy. She offended when you saying you a big back because she feel judged because she way more than you. It's subjective. So, take people's feelings, take people's feelings lightly. Not lightly, I'm sorry. Take people's feelings. Just be careful. Careful what you say and careful who you say it around. Okay? So yeah, and the way these men is calling people big backs too, I don't like it. Now, I saw a video the other day. It was hilarious. It was some lady had fried these two. I don't know where she fried this fish in, but it was so crispy and delicious looking. Now, this right here is big back behavior. I don't know if it was canola oil, peanut oil, olive oil. I don't know if she put some Dax, hair grease oil, and I don't know what she put in there, but that fish looked good. But what she did is she took a big dollop of potato salad and put it on top of that white Stroman's bread. Y'all know that Stroman's bread when you see it. And the man in the video called her a big back hot mouth hussy. Now, I hollered for about 25 minutes and watched the video about 10 times, but that wasn't nice. So I say it to say it might sound funny and it might sound cute, but take people's feelings, seriously, and don't just go slinging around the word big back, even if you're talking about yourself, okay? Because we're gonna spread loving seeds. We're not gonna spread big back hot mouth hussy seeds, okay? All right, y'all. I hope you learned something from this. I hope you now understand hemoglobin A1C, prediabetes, and that it actually is a treatment, medical as well as lifestyle. And if you're not getting what you need from your provider, if you're in Atlanta, well, I'll do a telemedicine too, but if you trying to get on the right path for this, be serious, because I will check you. My patients know I checks them, okay? But I am willing to help anybody who wants to be helped, because this is something that can be avoided in our community, and nobody's being aggressive enough about it. So I hope this blessed somebody, and this was supposed to be a Thursday podcast, but girl, take what you get, and have an amazing weekend. Bye, y'all.